Thank you so much, Linda, and welcome to session 8. I am Jill Morgan from Emory University Hospital, and I will be moderating this session. As Linda sort of introduced us to, this session will explore standards in PPE conformity testing, certification, and maintaining the integrity in every sense of PPE products when they are stored, decontaminated, reused, all of that. The Healthcare and Public Health Sector Joint Supply Chain Resiliency Working Group's Product Standardization Task Force identified numerous gaps, as Linda said, in the standards around conformity assessment across PPE types. For example, respirators that have been a large topic of our conversation have the most rigorous oversight in some ways around conformity assessments, but there are no requirements that cover the efficacy, for instance, of cleaning or disinfecting or decontaminating respirators. Another example is the lack of conformity assessment for criteria for gloves. We also know and heard yesterday about gaps in surveilling conformity to standards post-market. I'm grateful for a panel of subject matter experts who will share their perspectives and their expertise with us. Each will have, again, as we did yesterday, about 5 minutes, and then we will finish this session with a question and answer period. And as Linda said, for our audience, if you have questions, please use the Q&A section at the bottom of your Zoom panel. Panelist bios are available on the web page for this event, and so if you have any want to see more about where our panelists are from, you can access that information there. I am very pleased to start off today with John Zalata. John is the Deputy Director at NPPTL, and I'm going to try today to do a little better job for some of our audience members and actually at least once say what some of these abbreviations are. So that's the National Personal Protective Technologies Laboratory, a research center within NIOSH. And I'll leave NIOSH as something I hope people understand. So John, I'm going to turn it over to you.
Great, thank you, Jill. I'm really pleased to be part of today's panel discussion. And I think in looking at getting ready for today, I looked at the 2021 National Strategy for a Resilient Public Health Supply Chain, and there were 3 identified key elements of resilience that were part of the supply chain. That included robustness, visibility, and agility. And looking at this, that conformity assessment, the concept of conformity assessment, that's the focus of our panel, is also an integral part of what can be done in developing a path forward, looking to support those elements. The strategy talked about and recommended that a durable process that for assuring conformity assessment of PPE with relevant standards should be developed and deployed during stable planning conditions, and that this process should ensure the quality of and the appropriate use for the supply of products prior to an emergency actually arising. The strategy also talked about that the federal agencies like NIOSH should participate with other overlapping authorities to plan for future collaborations to implement this process. The strategy, the strategy that was discussed looked at effective supply chain to address 2 primary issues. One was the quality of products that were received, and then also the other was about inconsistent coordination across federal, state, and local partners. And in looking at our path forward, we would need to document a strategy for addressing these issues moving forward to support effective quality and coordination. The effective or ineffective supply chain starts with designating the required standards to which products must conform, coupled with a reliable means for demonstrating conformance during the product life cycle. These standards inform the supply chain by identifying the performance, quality, and reliability of qualified products. And then just a couple other points from the strategy that I wanted to mention were that the strategy should clearly inform potential suppliers about the standards and acceptable conformity assessment approaches to assist in preparing for acquisitions. That the PPE conformity assessment framework to establish a national process such as third-party certification of supplier qualification should be considered, and I have a couple comments about that in a minute. And then also there should be clear inspection and acceptance criteria and that supplier should be monitored for performance through ongoing audits of supplier required qualifications to provide needed assurances of qualified supplies. And looking at this, that putting it simply, conformity assessment is the demonstration that a product meets specified requirements. Conformity assessment can verify that a product meets a given level of quality or safety. It can provide explicit or implicit information about the product's characteristics, the consistency of those characteristics, and the performance of the product. Conformity assessment also can increase a buyer's confidence in a product, furnish useful information to a buyer, and help substantiate advertising and labeling claims. Information on conformance or non-conformance to a particular standard can provide an efficient method of conveying information needed by regulators or buyers on the product's safety and suitability. Conformity assessment is the vital link between product requirements and the products themselves. Although the Occupational Safety and Health Administration and other agencies like NIOSH publish guidance for effective worker protection using PPE, there is currently no single regulatory body, official guidance, or mandating authority for the conformity assessment of all PPE. And looking at the realm of standards from this perspective, I have a few points, and they've been mentioned already during the course of our discussion, that respirators have the greatest degree of regulatory oversight. There is a federal regulation that identifies requirements for those products, and NIOSH does perform post-market evaluations that evaluate how the product is performing in the field, and we've heard about those types of things in this and other forums. And looking at the realm of standards, few PPE standards have defined conformity assessment requirements in place, let alone standards that look at life cycle requirements. Jeff Stahl is going to be talking in a couple minutes about some of the conformity assessment requirements and standards organizations and current products. I think in terms of looking at standards, that through processes like we're going through now, that identifying specific gaps and limitations in PPE standards would aid in targeting needed changes and what those changes could bring to assuring the performance of the products that they perform as intended. And then there are opportunities to bring recommendations forward for the improvement of existing standards and to foster development of new standards that address the life cycle of PPE products. Several years back, in the absence of national policy and guidance, NIOSH developed the National Framework for Personal Protective Equipment Conformity Assessment that established a set of principles and provide recommendation for conformity assessment of PPE products in the United States. This is accomplished through addressing risk of worker exposure as a result of using a non-conforming product. The framework helps advance the PPE industry by meeting the need for a consistent risk-based approach to conformity assessment. And looking at this, that standards are a critical part of the conformity assessment process. Standards provide the basis for conformity assessment activities that in turn are the basis for many buyer-seller transactions. Standards used in conformity assessment activities can have tremendous impacts on companies and nations and even economic fabric of the world market. Standards can cover many aspects of the conformity assessment process. They can describe characteristics of the product for which conformity is sought, the methodology, things like test, inspection, or other methods used to assess that conformity, or even how the conformity assessment process itself, how the certification program could be operated. Thank you for your attention. I look forward to hearing my colleagues' presentation and further discussion this morning.
Thank you, John. All right, we're going to move to Jeff Stahl. Jeff is the president of the International Personnel Protection Incorporated. Sorry, I stumbled over that. Jeff, thank you for being here.
Not a problem. Thank you very much for being invited to participate today. So I'm going to try to cover a lot of areas relative to mostly the other products beyond respirators. So if we go to the next slide, I'll give you a perspective. We heard John just say respirators obviously are on the high end of that conformity assessment spectrum. But when you get to these other products, whether they're face masks, medical masks, face shields, gloves, gowns, other apparel that can be used in these settings, both primarily for healthcare as well as by the general public for various reasons or portions of these things, it gets a little grayer. So for all these products in one sense or another, there is some FDA oversight, and I'll describe that. When I say FDA oversight, this generally means one of two things. It means that a manufacturer has undertaken a program to demonstrate a product conforms to a standard, but they don't have that process or that product reviewed. And there are some products that fit into that scheme. In other cases, there's a more formalized process, a 510K, which essentially is a way for a manufacturer to demonstrate a pre-market notification. The product isn't approved, it's cleared, meaning that the FDA has reviewed the product for what it believes is appropriate, and they have guidance documents. Unfortunately, those are difficult to update, and there's a lot of misunderstanding about what FDA clearance really means. Some manufacturers, unfortunately, will say, well, I got this certificate that says I'm registered. Well, first of all, there's no certificate to be gotten. They often work through a third party to get a certificate, and they issue a certificate to put an FDA logo on that, and then they're thinking they're all great. But that's not the case at all. In fact, if you go on the FDA registration site, you'll note that the registration to and the placement of a manufacturer manufacturing what they call medical device establishment and the products listed by the medical device establishment doesn't mean any condonance whatsoever from the FDA. So where does that leave us? Well, I will tell you that when the FDA does review products through a 510K process, like things like medical masks and certain types of high-end gowns, that does include a rather robust review of the product. There are no on-site audits. There are no follow-on testing or anything like that. And there's no required conformity assessment. So it's really not a conformity assessment process, but it does in some cases provide an independent review so that that product can be listed as a cleared medical device. So where does this apply across the spectrum? Well, medical masks have those kinds of criteria. So do face shields, but they don't get a review process. Gloves are cleared by the FDA, and there are different standards in each of these areas. I'm going to cover those very quickly and give you a better perspective of that. Gowns, it's only the top or the higher performing gowns, and then for other apparel, it's a little hit or miss. So let's go to the next slide, and let me cover one of those areas. So medical masks, we have a standard in the United States, F2100. Was involved in putting that together many, many years ago. There was never a standard. And by the way, it was not developed originally as an item of personal protective equipment. It became personal protective equipment only when it included a requirement for fluid resistance. So as a part of that standard, they have these requirements, and this is going through the metamorphosis even now. But one of the things that I'd like to point out is that there are 3 levels. And I don't know whether healthcare really understands what those 3 levels really mean. They do impart different performance requirements, mainly in terms of fluid resistance and the ability, and there's relatively no guidance to provide what the meaning is between those different levels. In terms of conformity assessment, it is only just recently, this year, that the conformity assessment requirements have been added, and that only comes at a level of self-declaration. Moving to the next area, the next slide, let me talk about face shields and otherwise. Well, this is an item that is less reviewed. So you have a variety of different products. Probably the most likely product in a healthcare situation is going to be the product on the lower left, a disposable face shield. And there's a standard out there from the International Safety Equipment Association that's been in place that it covers the whole span of eyewear for industrial and educational purposes. That standard does not have a healthcare, and so there's ways to look at products and define it, but how someone gets to that, it's not entirely obvious. There's no conformity assessment process or requirements in that standard. And likewise, a new standard that came out last year, or actually, last year, was specifically mainly aimed at healthcare, but really all it is about is the prevention of blood spurts or blood sprays from contacting the face, eyes, or nose area, as demonstrated by a test in conjunction with some other requirements for visibility and clarity that are in the existing Z87.1 standard. What it doesn't do is it doesn't deal with things like cleaning. It doesn't provide things like address fogging and other issues, which are hugely important to a large number of end users. And again, it doesn't have a conformity assessment set of requirements. Moving to the next slide, just to cover gloves. Heard the statement about gloves. There's lots of standards on gloves, and to say that they're robust, I wouldn't go that far. Basically, standards gloves are defined in two ways. They're defined for their ability to have liquid integrity, which is a water test, and it's done under an acceptable quality limit, meaning that it's a significant sampling size. But beyond that, gloves are really judged on like their strength, their ability. They do go through a heat aging test, but there's no conformity assessment process whatsoever in any of these standards, with the exception of NFPA 1999, which covers exam gloves. Moving to the next slide, surgical and isolation gowns. This is a standard a little bit more robust. Again, no conformity assessment process. There are multiple standards run from AAMI to from ASTM, isolation versus surgical gowns. Only recently, conformity assessment has been added, and that includes supplier declaration. And then the last area I'll cover is there are other product areas. So we talk about, if you go to the last slide, the next to last slide, one standard, which actually has independent third-party certifications for the emergency responders. So the firefighters and EMTs, there's a standard that covers that, and it requires third-party certification. However, that standard is so robust that most of the industry just ignores it. And it's unfortunate because there's a certification process, and this may be the impediment of the costs or other aspects that keep people away from that. So to sum everything up on my last slide, I'd just like to point out that respirators obviously have a large degree of conformity assessment. There's a resistance to introducing certification requirements in some of these other standards because of cost, difficulty, accountability, a variety of things. There's also confusion how standards really apply. The FDA process, it's not clear what that really means. And likewise, when we do have standards with levels in it, it's always understood what those mean. Lastly, the issues I think that have been aptly brought up before, cleaning effectiveness is generally not done. There's no surveillance processes on most of these products. There's no other metrics to even measure how this stuff is even effective. And the very last point that I would leave you with is, we talk about standards. There's standards forums out there to make standards, but standards don't happen unless there's standards champions. And then it's not, if you say, oh, I want to do this. Well, that's fine. You need to bring a standard to them, and you need to make your voice, and you need to involve the right people, the end users, so on and so forth. So thank you for your attention. I look forward to the rest of the panel discussion today. Thank you.
Thank you so much, Jeff. And I know that we are asking you guys to do an awful lot of work to explain things that are very big and complex problems in a very short period of time. So I appreciate everyone. Our next speaker is Gordon Gillerman, Director of Standards Coordination Officer at NIST, the National Institute of Standards and Technology. Thanks, Gordon.
Thanks, Jill. So I'm going to try to kind of take a big step back here, and maybe we can leave this slide off just for a moment. There you go. Thank you. So we've heard a lot of terms thrown out about conformity assessment, and I just want to take a step back on some of the concepts here. One of the things at NIST is we are very risk driven. So we like to understand risks associated and how to get to a reasonable, tolerable risk level. So what we're thinking about here in conformity assessment is, what are the risks associated with the non-conformity of these products, right? How bad will it be? How often will we see those results? The two elements of risk: frequency of the hazard occurring and the consequences of the hazard. So if we look at these things on an individual basis and think about how to approach conformity assessment from a risk-based proposal, we think about how we bring more confidence for PPE where the risk level is higher, either where the consequences of nonconformity are really significant, or where the frequency related to the hazard and nonconformity of the products would be frequent. Some product of these things gets us to the concept of risk. And there's two big factors here in conformity assessment. One is the technical rigor of the conformity assessment program. A lot of that is driven by the technical standards for product performance. right? The more technical requirements are for product performance, the more tests we're going to run. We might look at life cycle testing, and I'll talk about that a little bit later. And we might also look about testing products with their normal cleaning and disinfecting, and then trying them again in the test methodology to see if they still perform as expected. These all have to do with the technical rigor of conformity assessment programs. But the confidence itself is often determined by who makes an attestation of conformity. Who tells the public these things meet the requirements? And generally, you have three choices. One is the manufacturer. Trust me, my products conform to the requirements. The second is the product consumer and user. I'm going to test the sample of it when I get it to make sure it works before I deploy it. That's challenging in this area because the test equipment is very special, and I don't think most people in the public or even businesses have it. And so the last choice is for that attestation to be made by a third party. And there's two niches to this that we'll talk about, and I'll show the slide in a moment. One is a third party running a set of tests on a group of samples and saying, here are the test results that come from a laboratory that is impartial to the transaction between the seller of the product and the buyer of the product. And the other one is a certification, where based on an evaluation of evidence, including in this case, test results, a certifier says, not only did the ones in the lab that were tested conform to the requirements, but I'm telling you that I've put in place a system to give me confidence that the entire population of these products that's going out into deployment conform to the requirements. These are really different things. Can you bring the slide up now? Thank you. So conformity assessment really exists in this hierarchy. And it really is this question of who's watching who. And so what we see at the bottom of this truncated pyramid is the object of the assessment. In this case, it's going to be the personal protective equipment. If I'm a laboratory, I could be a manufacturer's laboratory, not a third-party laboratory. I could be a laboratory for a user who has the right equipment, or I could be a third-party laboratory. All of them have potentially the capability to run these tests. And in this system, it's also possible that we have an accreditor. Jeff mentioned in one of his slides, accredited laboratory testing. So an accreditor's job is to determine that conformity assessment organizations, laboratories and certification organizations are competent to carry out the technical work that's in their scope of work and have an underlying quality and risk management system generally that meets international standards. And there are standards for conformity assessment. There's a whole category of them. For certification, the certification body is always a third party. So a third party, like my former employer, Underwriters Laboratories, if you look at the hairdryer that most of you may own, has a UL and a circle mark on it somewhere. That's Underwriters Laboratories mark. That mark means that UL as a certification organization is telling you that this product that you own conforms to the requirements, even though they didn't test it, because if they tested that one, it would be broken. Because many of these tests are destructive, and none of the products that are tested in the lab ever get out to deployment. So this connection between what you learn about products by testing samples that never go into use in the laboratory and the conformity and performance of an entire population is a really important concept. So just because a group of samples test in a laboratory and demonstrate data that meets the requirements does not necessarily mean that tomorrow's production, next week's production, next year's production will continue to conform to those requirements, because the supplier may change their production process. They may change materials. In a certification process driven by a third party, there's some form of surveillance activities. The National Personal Protective Technology Laboratory performs their own form of surveillance on NIOSH certified respirators. So it's all of these elements coming together that present different combinations of conformity assessment. You can have a complete supplier's declaration. It's up to the manufacturer of the product to demonstrate conformity, and the manufacturer of the product declares that the entire population of the product conform. A supplier's declaration of conformity, as mentioned by Jeff. You could have testing at an independent third-party laboratory, but still have the declaration of the entire population of products be the responsibility of the manufacturer. It is a supplier's declaration supported by third-party laboratory testing or accredited third-party laboratory testing if the laboratory is accredited. Or you can have a product that's certified where a certification body is providing confidence that the products in the marketplace meet the requirements. So there's a lot of approaches to conformity assessment, and it's really important that we have a keen understanding and a risk-based process for looking at which kind of conformity assessment is appropriated for what kind of PPE and PPT, given their use and given the risks. Thanks.
Thank you so much, Gordon. All right, next is Dr. Lisa Brosseau. She is a retired professor from the University of Illinois at Chicago and has a long history with all sorts of personal protective devices. Thank you so much for being here, Lisa.
Thank you, Jill. Thank you for the opportunity to participate in this session. So in addition to being focused on performance, standards need to be informed by the science, and that's the job of academics and researchers. So science, having science doesn't mean we have to wait and can't move forward when it's lacking, but we need to understand the limits of scientific knowledge when we're developing standards for PPE. And that's why the requirement that a consensus standard be reevaluated every few years is important, because scientific knowledge can change rapidly. So I'll give an example of this. We have a barrier face covering standard that was developed a couple of years ago during the pandemic. But that barrier face covering is, the purpose of that standard is to evaluate the ability of a face mask or barrier face covering to limit outward leakage or the emission of particles from inside the mask. There are validated methods for assessing inward leakage or the inward movement of particles into a respirator, for example, which is important for ensuring the wearer is protected from contaminants outside the face piece. But during the pandemic, we were more interested in what was coming out of the face piece. At the moment, the best method for this involves measuring particle concentrations in a chamber with a mannequin wearing a mask compared to particle concentrations when the mannequin is not wearing a mask. Mannequins, of course, are not like people, but making such measurements on face pieces worn by people isn't at all easy. I won't give you all the details about that, but what we know from studies using that mannequin method, which was conducted at NIOSH, is that inward and outward leakage are similar for things that have good fit filters and good fit, meaning respirators. But inward and outward leakage are not similar for things that have poor filters and don't fit well, and that means cloth and surgical masks. So using inward leakage as a surrogate for outward leakage isn't appropriate for all types of face pieces. Now, eventually, the ASTM barrier face covering standard is going to be updated with some type of outward leakage method once the science points us in the right direction. Speakers yesterday discussed the need for mask and respirator standards for the public, which I agree is an important gap we need to fill quickly before another pandemic, as well as to protect the public from other types of hazardous aerosols. It may be, however, that we don't really need something as good as a respirator, which is designed to be worn for 8 or more hours in a workplace, but it should be something better than the typical cloth or surgical mask. So do we need the same standards and expectations for public respirators as we have for those used in the workplace? In some respects, I think the answer is yes. The tests used to evaluate filter efficiency and breathing resistance are very appropriate for all types of things worn on the face. But there are clearly other outcomes that are important to the public and workers required to wear PPE day after day, such as comfort, ease of use, reusability, cleanability, etc., that are not encompassed in current respirator standards. I'm mostly going to talk about respirators. Do we need 95% filter efficiency at NIOSH test conditions for a public respirator? Well, perhaps not, because N95 filters are actually over-engineered even for most workplace exposures. We also need lower breathing resistance than the NIOSH standards call for, since the public population is very different from the working one. And how do we ensure good fit if most people won't be able to conduct a fit test as is required for the workplace? I know NIOSH is seeking creative solutions to this last problem. It's also important to consider standards and performance requirements in the context of a pandemic. How is a pandemic different from other types of emergencies, and how do the differences impact the types of PPE we need and the supply chain that's necessary? We don't need to add to the already heavy burden of solid waste with large quantities of disposable PPE, for example. We need standards that ensure long-term storage and interoperability and reusability, and standards for rapid manufacturing without sacrificing quality and user safety. So underlying the decisions about which interventions to use during a pandemic is the planning that preceded the event. The National Pandemic Plan, which focuses on influenza, does not mention the words airborne or aerosol anywhere and never discusses the use of respirators or masks. Hopefully, we will rethink our National Pandemic Plan with a more precautionary approach, which is that the next pandemic is likely to involve an organism that is highly transmissible by aerosol inhalation person to person, and it is also likely to have much higher lethality than SARS-CoV-2. And I think this is really key. A more precautionary approach will help us move toward ensuring both a better and adequate supply of PPE for everyone, workers and the public, in the next pandemic. Thank you.
Gosh, thank you so much, Lisa. It's a great reminder that looking backward only gives us so much information, and looking forward to what might come next might be very, very different. All right, our next speaker is David Simke-Levi from, he's a professor of engineering at MIT. Thank you for being here, David.
Thank you. Can I share my screen? Don't have the ability, or I send the slides. Is it possible to give me permission? Beautiful. Very nice. So I'm going to spend just a few minutes about supply chain resiliency. That's the area that I focus on in my research at MIT. If you go to the next slide, and I'll connect it with the topic of discussion in this session. If you look at the time before the pandemic, for 10 or 20 years, most companies in a variety of industries focus on supply chain efficiency through strategies like lean, like outsourcing, like offshoring. And these companies have been extremely successful in cutting costs from their supply chain. But we know, and in fact, we knew all along, that these strategies that help companies cut costs significantly increase exposure to risk. So if you click again, you will see examples from, please hit again on the next slide. You can see that events like the tsunami in Japan and the flood in Thailand have made enormous impact on companies in a variety of industries. And so click again, please. You will see that we at MIT collaborated with initially the Ford Motor Company to develop a new way for companies to identify the level of resiliency in their supply chain, find hidden risk, and develop mitigation strategies. Between the time this paper was published in 2014 and the beginning of the pandemic, there was very little interest in focusing on resiliency. Everything changed at the beginning of the pandemic, and this is directly related to the topic of discussion today. If you click again, you can see that at the beginning of the pandemic, I started collecting data in January of 2020 on what's happening in China. And I realized that I can use the model that was developed 6 years earlier in 2013, 2014, to understand the impact of what's happening in China on supply chain in North America and Europe. I submitted these papers that you see on the right-hand side to Harvard Business Review in February, and it received enormous amount of attention. And what did we say in February? In fact, at the beginning of February, when we submitted the paper, related to supply chain. We said that the peak of the impact of COVID-19 on global supply chain will happen in mid-March, forcing companies in North America and in Europe to shut down or significantly reduce manufacturing and assembly activities. And if you click again, you can see this is exactly what happened. On March 17, Fortune magazine reported that the automotive industry in Europe is shutting down. If you click again, you can see that the New York Times reported the day after that the automotive industry in Canada, Mexico, and United States are all shutting down. So a lot of interest right after this incredible ability of data and analytics to predict what will happen 8 weeks later. I followed up, if you click again, with another piece in Harvard Business Review where I said we need stress tests for critical supply chain. And I emphasize the framework, the technology, the KPIs, the capabilities are here for companies to use. And I highlighted 3 industries where this is very important. Obviously, healthcare, the topic of discussion today, life science, and the food industry. I was excited to see that last year in the US President Economic Report, there was a reference directly to this type of capability. And so I will just highlight with a brief discussion, what are the capabilities that I think we need to apply to supply chain in healthcare, the type of products that you're discussing to help us improve our resiliency and identify how much risk we are exposed to. If you go to the next slide, you can see a simplified version of the Ford supply chain. This is different than what you see in PPEs, but the technology, the concept are the same across industry. Click please again, and you can see 2 concepts. One is what I call time to recover, how long it takes for a specific facility, say manufacturing facility, distribution center, other facilities in the supply chain to recover to full functionality after a disruption. This is scenario dependent, but we can estimate this. And if you click again, you can see that in one scenario, we estimate time to recover for the chemical supplier to be about 2 weeks. And given that we mapped the entire supply chain, and given that we have information about time to recover, we can estimate performance impact, which is, in our case, the ability to match supply with demand, the ability to provide the service that we are focusing on to the specific market. And it can be either service level, it can be revenue, which was the focus of companies like Ford, or market share, or it can be operational measure like impact on lost production. And if you can click here again, you can see the impact that Ford estimated with the disruption. But you don't need to believe just this slide. If I go to the next slide, you can see screenshot, click twice, and you will see that risk. This is data from Ford. Risk is hidden in unexpected places. Ford executives were focusing on the strategic components in their supply chain, the one where they spend huge amount of money with every year. It turns out that the riskiest part of their business is at the bottom right-hand side of this slide, which are components that cost 10 cents. But if these components that cost 10 cents are disrupted, enormous impact on Ford supply chain. And the second insight that I want to highlight, if you click again, is that this is not directly related to geography. There is a notion in the public media that if you just move manufacturing activities from, say, Asia, closer to market demand, you are going to guarantee resiliency. This is not consistent with our data and analysis. And it may be important to move manufacturing activities close to market demand for many reasons, but by itself, it does not ensure resiliency. If you look at the figure here, you can see bubble representing many of Ford's suppliers. the size of a bubble is proportional to risk that each supplier exposed to. And you can see immediately, risky suppliers are everywhere. They are in Asia, they are in Europe, and they are in North America. And we have seen this over and over again during the pandemic with the impact of COVID-19 on the food industry. It's mostly domestic in the pork and meat industry, but because this industry went through significant consolidation, when one of the manufacturing facilities was affected, enormous impact on the supply of meat and pork in North America. And if you click again, you can see my second insight. Now remember, and I will complete this discussion with the next slide, remember, time to recover is all scenario dependent, and we typically generate multiple scenarios to represent what can happen in the market. But we need also measures that are independent of scenarios. And this is the measures that I call time to survive, that identify how long can we match supply with demand once a specific facility in the supply chain is disrupted. And if this time to survive measure is very short, no matter what scenario is, I'm very concerned about the supply chain ability to match supply with demand. I emphasized here an example of, in the automotive industry, of the implementation at Ford. If you click again, you can see the insight from the implementation at Ford. But in general, I want to highlight this was implemented at companies in consumer packaged goods, high-tech appliance manufacturers, and the automotive industry with very similar insights, suggesting that just intuitive analysis of the supply chain does not necessarily give you an insight into where risk is, how to develop mitigation strategies, and how to make sure that you can continuously match supply with demand, especially in healthcare. Let me pause here. Thank you.
Thank you so much, David. That was a great way for us to sort of bring everybody back for some conversation about this link between the supply chain and conformity assessment. So I'm going to ask our panelists to help me understand how conformity assessments impact supply chain, and do conformity assessments, where we have them or where we might want to have them, end up necessarily extending, I think, what David referred to as that time to survive, right? When supply and demand can be rematched again. So I'm grateful for you smart people here, because that really got complicated in my mind, and I'm glad that you're going to help us understand it. So please just bring yourself off mute and let's talk about this.
So maybe I'll start. So as I said before, we have a lot of different approaches to designing the conformity assessment systems or schemes. And the more you require third-party intervention, the longer the time to recover. So if you have a supply chain hiccup and you need to substitute a new material in the supply chain because one supplier is out of business or down, then if you have a third-party certification, there's going to need to be a demonstration of conformity that the new material, when built into the already certified product in its new construction, is going to have to go through testing in its new form, and it's going to have to get certified in its new form. So all of that is going to take time. Now, if you think about if it was a completely supplier's declaration system where the supplier had the technical wherewithal to competently run all of the tests necessary to demonstrate compliance, the supplier in their own house, or the manufacturer in their own house, could make a determination about whether the product with the new materials meets the requirement, make an attestation of conformity, a supplier's declaration of conformity, and be in the market quicker than if they had to contract with a outside laboratory who might be independent and accredited, or if they had to do that plus go through a certification process, which included perhaps some surveillance activities. So, one thing to think about is there is going to be this tension between the level of confidence that you get from having third-party activities in conformity assessment, which are generally considered to be higher confidence than suppliers' activities in conformity assessment, and your time to recover, as our last speaker quoted it. So I really like the engineering approach there. We might think that there might be times during critical issues in the supply chain where we could flex down our confidence needs publicly in order to recover the supply quicker. There might also be thoughts about how you could distribute conformity assessment resources that would be in perhaps multiple geographic locations, less likely to be impacted by the same adverse events, that could still have availability and bandwidth and capacity to do the necessary conformity assessment if you still wanted either the same level of confidence or something similar, or perhaps something better than just allowing the manufacturer to run the test and declare their own conformity for the entire population of products that flow into the market.
And I'll add to that. So the other part of this process that could be affected is new entrants to a market. So as an example, during the pandemic, the state of New York wants to buy tens of millions of surgical gowns, and they enlist suppliers that are unfamiliar with the market and industry requirements, and they spell out what they want. They relax those requirements, as Gordon suggests that they might do. But even so, that lack of familiarity and then the resources that they're depending on, obviously they don't have the connections that, say, another established manufacturer might have to ramp up. So the ability to ramp up by including new entrants to the marketplace is affected by conformity assessment requirements as well.
So I can connect, Jill, your question with the experience that I have in the food industry. In the food industry, you have similar challenges. And what we found in implementation in a large CPG company is that the ability to look at the sensitivity of supply chain performance to time to recover allows the company to understand what is the impact of certification on their business and therefore on the supply chain strategy. The idea was at some point, the company received a notification from one of its suppliers that the production process is contaminated. They need to stop the production and then ramp up capacity. But it was clear that it will take also time to make sure that the quality is at the level that the CPG needs, the certification process. And the question is, what is the impact of the certification process on the supply chain strategy? Because you have the relationship in this type of framework between supply chain performance, business performance, and time to recover, you realize how sensitive you are to how long it takes to certify a process. And in one case, if it takes 30 days to certify, and the model indicates that 30 days, you are not going to see big impact on your supply chain because your supply chain can still match supply with demand, then you know that this is not a bigger impact. But if certification takes longer than that, bigger impact on business performance. The point is quantify the relationship between time to recover and business performance, allow us to get an insight into what is the role and the impact of certification on the supply chain.
That's great. Thank you, David. And I just want to ask a little bit of a related question here about, perhaps different from the food supply chain. I think in many facilities, people are using sort of a just-in-time stocking model, right? So we don't end up with huge quantities. And yet we are talking about at least supplies that seem to have a fairly long shelf life, right? So things that don't have to be fresh compared to like a tomato. So is this in some ways being complicated by this just-in-time stocking model?
If you're asking me, there is no question that lean and just-in-time increase exposure to risk. But what companies now realize that this is not just about lean and just-in-time. This is about finding the right balance between efficiency and resiliency by being able to quantify both efficiency, impact on cost, and resiliency, impact on your time to survive time to recover, and business performance, you identify where do you want to be on this trade-off curve. It is true that up to the beginning of the pandemic, it was mostly focusing on efficiency, on lean, but we see a big shift from just in time to a combination of just in time and just in case.
Yeah, I think it's really an interesting and provocative question, and I think one of the things I was taken with both yesterday and today is this idea of what must make emergency managers' heads just explode. This idea of what we would call in our industry a full-scale exercise, which I think this stress test for critical supply chains is really asking, okay, can we model this? Can we sit down and have a nationwide conversation about where these potential pressure points and pinch points are in the system and how we can address those, is really, to me, very, very interesting. And again, something I think emergency managers across the country are going to be interested in. If you don't mind, I want to ask a question from my own perspective. And Lisa, let me let you speak first, though.
Sure. It strikes me that when we're talking about standards for PPE, we might think about how you would step down from conformity assessment, for example, to address these issues of, supply chain resiliency. A really good example is what happened with KN95s. I mean, FDA allowed a whole bunch of these to suddenly be, imported into the country and everybody using them. And then people started to say, it doesn't look like they're really working. There's some problems with them. And basically, eventually NIOSH tested them, but they only tested filter efficiency of a certain number of models. All the rest of the stuff that we care about in terms of respirators was not tested. But that's that's one of the key measures is filter efficiency. And, it's not perfect, but it was a really good option when you needed lots and lots and lots of testing in a really short period of time so you can make a decision. So we also need to be thinking about our standards and our conformity assessment in the context of a supply chain break, so to speak. And how do you make that, or how do you make the conformity assessment process still work and address risks without impacting health and safety?
So Jill, just to come back around, I think the one other factor that impacted what Lisa just talked about is counterfeiting, right? The fact that not only did you have KN95s coming from another country's standards and conformity assessment system, but you also had a rife place for counterfeiting. And so how can you, both address the counterfeit issues simultaneously to the increased need for PPE and the need to adjust supply chains accordingly? So it makes it more complicated, not less.
Yep, I agree. And in fact, that's a perfect segue. Thank you, Gordon, for that, because I want to ask you guys, we've talked about conformity assessment, and much of this conversation has been about sort of the sampling at the point of creation. And I'm wondering about conformity assessment as we talk about a supply chain over the life of that supply chain. So thinking about, what do we know about ongoing conformity for things that are stocked or put on shelves or put in a warehouse? And I know that some studies were done, and we're grateful for the research that told us that at least some of the qualities of respirators were still intact after being past their expiration date. But as Lisa just said, that doesn't tell us about the rest of the qualities of a respirator that can be really important, nor do we, to my knowledge, know anything more about other types of PPE and the conformity, again, moving along its lifespan. So can we talk about that for just a minute?
Yeah, I'll chime in first, Jill. I think you bring up a good point, and I think in looking at something, like a respirator, that you do have robust standards, for assessing conformity assessment, but I think the thing where the transition needs to happen, at least in terms of looking at it from systems approach and the life cycle of the product, is we don't have information, or our requirements don't include anything about reporting from inventory or distribution. That's a void. Once we issue an approval and manufacturers start producing them, other than if we get involved with an activity, let's say it's a stockpile, we completely lose visibility of the process. And I think it's one of the gaps that probably needs to be addressed as far as how do we, from a conformity assessment perspective and development of standards, how do we monitor that type of performance, through audits or some other type of assurances of the product.
Yeah, it's a difficult thing because, of course, I'm sure people feel like you sort of lose control, right? I mean, they leave the factory and then, the conditions and the storage conditions, whether that's heat or humidity or temperature, it's all sort of out of people's hands. So, but from an end user standpoint, of course, it's very, very important. Gordon, I saw you come off mute.
Yeah, I'll just note a couple of things. One, and one of the things that I get to do is I get to work in standards and conformity assessment with no boundaries. So I work across all product categories, services, IT. And so just a couple of different experiences. So one is from kind of the industrial motors and transformer space, where they use a coating on the wiring that they use to wind the turns of motors and transformers. And that insulation that's coated on top of the wire has to last for 40 years in a heavy duty industrial environment, but it's not tested over and over again once it's put in place. So in the initial performance standard, they have developed a test methodology to give them a way to evaluate the product's use over its anticipated life. In the case there, they throw all the insulating materials in test tubes and put them in ovens and drive the temperature of the ovens up and down rapidly over 18 months, and then retest the dielectric properties of the materials at various timeframes during this testing. It gives them confidence that if all these insulating materials are used together, applied appropriately in a transformer or a motor, and it's going to be used in industrial application, that it can last 40 years and be safe and effective. And another world that's a little bit creeping closer to this is the world of body armor, which I've been very involved in. In 2004, there was a situation with a new material being brought into the world of body armor that had great, as tested, initial performance. But what they found, unfortunately, based on an incident, was that it was losing its basic material strength in a short period of time in a relatively normal environment. And so the standard for body armor evaluated and created an engineering solution and developed an aging test. And now the body armor is shot in the laboratory in an as-received state and then conditioned to simulate what they think drives it through about 5 years of this kind of a cycle. And then they shoot it again and look at the performance in that state. It gives confidence that this body armor has a life that's relatively understood from a performance perspective.
And I'll just say that in the body of PPE, glove standards, as simple as they may be, do have a heat aging test. To the degree to which those may emulate actual storage conditions. Anyone that's had gloves that sat in a hot environment for an extended period of time, you pull one glove out to get all 100 out of the container. I mean, obviously that's an indication that something's been bad with the storage, but to the degree that that type of testing is done is actually fairly limited in the PPE arena.
And can I ask about this idea? I think, Jeff, you first brought it up of supplier or self-declaration of conformity assessments. I have to say, at this point in my life, I'm a skeptic, right? To what extent do I want to trust a company's goodwill? I happen to live in one of the states that was okay with peanut butter being contaminated, right? Until they got caught. I don't trust a company necessarily, especially when it's my safety. So how are self-declarations okay? Is there a good history of them? Because I don't know that.
Well, it's just like anything. There are some that are companies are very diligent about trying to do the right thing, and some that may cut corners, and there may be other unfortunate motives involved as well. But I will say that there are some in-between solutions. Just using it, having test results that come from an independent accredited laboratory, or having a declaration statement that includes those test reports, gives obviously that manufacturer is still arranging the testing, providing the samples, that sort of thing. It's not perfect, but it's an intermediate solution that may be less costly. And Gordon described some of those variants of that conformity assessment process. And that's where I think where we're starting to move a lot of this stuff towards. So it's a little bit more nimble in terms of not being as resource consuming in the part of a robust third party certification program. But the other hand, it does miss certain attributes. We want the manufacturers to have, continued quality control, frequent follow-on testing, all that sort of thing. And they could be ISO 9001, but anyone that realizes ISO 9001 really just simply documents the process that you have. It doesn't document that you have a good process. It just says that you're making something consistently and documenting that consistently.
Yeah, I think this is something that the national framework could help, at least in terms of looking at, the identifying the right type of conformity assessment, that the framework is based on risk and assessing the risk of the user's exposure as a result of a non-conforming product, and you can assign levels of risk based upon the type of injury that is being that could potentially be seen. So that may be use of the framework might be something to help with the process of looking at how conformity assessment programs could be set up based on the type of equipment.
Thanks for that, John. I'm going to go to Victoria to come off mute for a second, one of our other presenters. Go ahead, Victoria.
Yes, ma'am. Thank you. I just wanted to bring up that there's a certain factor of conformity assessment and standards possibly changing throughout the pandemic. A lot of us think that face shields started as a way to protect the eyes of the healthcare worker. That's not exactly true. It ended up being that. But the reason why face shields were such an early demand, even before the NIH DTM face shield that posted on the end of March on the NIH 3D printer exchange, was healthcare workers were trying to preserve their N95. So there was a huge demand for face shields that went down below the chin to protect the N95 from droplet exposure, because there was this months-long focus on extending the life of the N95 as long as possible. There were some physicians we worked with that were on their 10th week of N95 usage in the middle of March. So as time went on, face shields started to shorten a little bit, and the focus was more on, well, we're going to use these for eye protection. So if we're thinking about design and material and every standard conforming, if you come out with a design that is to here and you're low on N95s and well, this is safe enough, well, the use case might change and we need to bring it down. So little changes like this are really important to note when we're talking about conformity over the life of the pandemic.
Yeah, thanks for that. And actually, it's a perfect segue, Victoria, to something that I was thinking about what really back when John Zalata sort of kicked this off. And that's this idea that, the conformity assessment really is matching the need of the end user, right? And making sure that something is meeting that need. And I wonder, in this really dynamic environment, we have a changing workplace, we have changing lifestyles, we have, all sorts of flux going on, if you will, that the qualities of some of the standards, how do we, I'm not sure at what point we still have relevance to the risk, and making sure that the qualities that are reflected in the standards are both relevant and sufficient to the risk that people are encountering. Does that, I sort of went around, there's a Southernism for it, but around the, I can't say it.
Well, going around the barn.
Yes.
Well, unfortunately, most standards are reactive rather than proactive. And I think the reality is, as you go through different situations and you find out how well the standard affected an industry under a set of circumstances, you need to go back to the standard. Do we need to have adaptations within that standard in order to anticipate the varied demand that may have or offer the variety of products? You know, that, I mean, you don't want to have too design prescriptive. That's why we like to rely mainly on performance requirements, but there's no doubt that you have to have some design criteria along with the performance criteria, along with the conformity assessment criteria. But if you think about it, in each of those areas, you can have levels or exceptions where things can be relaxed or changed depending on the circumstances.
So I'll also say that the user community needs to be considered in the technical standards for the performance requirements. You know, let's just think of the case of defibrillators. You have defibrillators that are intended for use by healthcare professionals in a healthcare setting, EMTs, doctors, nurses. You also have AEDs that are out in the public, intended to be used by everybody. The technical requirements for those products are vastly different, right? There's an anticipation that knowing when a patient needs a defibrillation, when they're shockable, you know, what the device says, is something that the AEDs have to have self-determination of. They also have to have a self-determination that the electrodes are in the right place. And they also have to call out for everybody to get away from it before it shocks the patient so you don't inadvertently hurt other people. These are characteristics that are not required in cardiac defibrillators in healthcare settings used by trained professionals. And so we can look at the different user communities for both what needs to be there for safety and effectiveness, but also what kind of reasonable abuse we would expect in each one of those communities.
Well, thank you all. I hate to shorten this conversation at all, because this is a topic that, as my husband says, I have a soapbox I just carry around with me about. We could go on all day, but we do need to wrap this up. I want to thank you guys so much to each of the panelists for your expertise, for your enthusiasm for the topic, and for really helping, I think, to shape some of our thinking as we move forward in this. We are now going to transition to the next session, session 9, on marketing, stockpiling, and distribution, which is going to be moderated by Ting-Long Dai. And I, again, just thank you guys so much for your rapt attention and for our panelists and their time and effort. Thank you, guys.